welcome to the deep dive. Today we're tackling something really crucial for our dogs and cats, understanding why they might suddenly produce very little urine, or maybe none at all.
Yeah, it's about figuring out what's going on when the output significantly drops.
Exactly, like understanding the body's plumbing and what happens when things get blocked up, or maybe the system's just not getting enough fluid.
And we're digging into insights from canine and feline Oliguria and Anuria to help us unpack this. The goal really is to pull out the key info so you can understand these conditions, Oliguria and Anuria,
Right.
what they mean, their causes, and why they're such important warning signs about a pet's health.
Okay, so those names, Oliguria and Anuria,
Yeah.
they sound a bit heavy, maybe a bit technical.
They can, yeah.
But what we really want to get at is the why, right? What's actually happening inside them when they're not peeing like they should?
All right.
Okay, let's start there. What do these terms mean in, practical terms?
Okay, so oliguria at its core just means the pet is making an abnormally small amount of urine, less than normal.
How small is small, though? Is there a specific number?
Well, that's where it gets a little variable. You'll see different definitions, maybe less than 0.5, sometimes less than 1.0 to 2.0 milliliters per kilogram per hour.
Okay.
But a key concept is what some call absolute oliguria. That's when urine output drops below 1 ml per kilogram per hour, even when the pet should have plenty of fluids like they're euvolemic or even hypervolemic and good blood flow.
Right.
To put it in perspective, a healthy, well-hydrated animal, maybe one on IV fluids, should definitely be producing at least that 1 ml per kilogram per hour.
Gotcha. So below that level, when they should be producing urine, that's a definite red flag.
Exactly.
And then there's anuria. That sounds even worse.
It is. It's very serious. Anuria means there's practically no urine being made, or maybe none at all. We're talking really low numbers, like less than 0.08 mils per kilogram per hour.
Wow.
Essentially, yeah, the tap's been turned completely off.
Okay, so that paints a clear picture of the what. Now let's get into the why. What's actually malfunctioning inside the body to cause this?
Right. So the reasons generally fall into a few main buckets. First, you've got what we call physiologic oliguria.
Physiologic, meaning like the body's normal response to something.
Exactly. Think of it as the body reacting sensibly, trying to conserve water when it senses it's running low. Maybe there's reduced blood flow to the kidneys, perhaps from dehydration or low blood pressure. So the body says, hold on, let's keep the fluid we have. A hormone called ADH, antidiuretic hormone, plays a big role here. It tells the kidneys, make less urine and make it really concentrated.
So the body's being smart, trying to protect itself when fluids are scarce.
Precisely.
But what about when it's not just the body trying to conserve, when the low urine output is actually a sign of a problem?
Right. That brings us to pathologic oliguria. Pathologic meaning, related to disease or damage. Here, the kidney itself is injured.
Okay.
Think of the kidney's tiny filters, the glomeruli. If they get damaged, or the blood vessels feeding them have high resistance, or the tubules downstream start leaking fluid back or get blocked.
So multiple potential failure points within the kidney itself.
Yes. Or even just losing a large number of the kidney's working units, the nephrons. If enough nephrons are gone, the overall filtering capacity just plummets and urine production drops.
That sounds pretty severe for the kidneys. And anuria, is that just the extreme end of this kidney damage?
It can be caused by really severe kidney damage, yes. But actually, more often, anuria points to a problem after the kidneys, what we call a post-renal issue.
Ah, okay, like downstream from the kidney.
Exactly. The classic example is a urinary tract obstruction, or UTO, a blockage, say, in the urethra, the tube leading out. The kidneys might still be trying to make urine, but it literally has nowhere to go.
Like a traffic jam.
Perfect analogy, a complete traffic jam. Or sometimes it could even be a rupture, a tear somewhere in the urinary pathway, so the urine leaks out before it can be expelled.
So it's clear it's not just the kidneys that are affected then. What other body systems get drawn into this when urine output drops?
Well, the big one is waste removal imbalance. Kidneys filter waste products like urea and creatinine and regulate electrolytes, especially potassium.
Right.
If they can't do that, these wastes build up, that's uremia. And potassium levels can rise dangerously high hyperkalemia. That's a major concern because high potassium can seriously affect the heart.
Okay, that sounds critical.
And with obstructions, the whole system upstream gets backed up, the ureters, the bladder. It all gets distended and stretched. Plus, if the bladder isn't emptying properly, the risk of urinary tract infections, UTIs, goes way up.
It really is a ripple effect then.
Definitely.
Now, are certain pets more prone to these issues? The source mentioned signalment.
Mm-hmm.
What does that tell us? Are we talking older pets, certain breeds?
It affects both dogs and cats, for sure. But we do see some patterns, for instance, anuria due to those urinary blockages. That's actually more common in younger adult cats.
Oh, interesting. Okay.
But on the flip side, the risk of acute kidney injury, which can cause either oliguria or anuria, generally tends to increase with age in both species.
Right, that makes sense. So for pet owners listening, what are the clues? What signs might they actually see at home that could point towards oliguria or anuria?
Well, the most direct sign, obviously, is noticing less urine, smaller puddles, fewer clumps in the litter box, or maybe seeing no urine at all.
Okay.
If it's a blockage, you might see them straining, going back and forth to the litter box, squatting repeatedly outside, but producing very little or nothing. They might cry out, seem painful.
That painful straining sounds like a clear sign something's wrong.
Absolutely. You might also notice their abdomen feels tense or painful, especially around the bladder area. And if it goes on for a bit, as those waste products build up,
The uremia you mentioned.
exactly, you might start seeing more general signs of illness, lethargy, just being really tired, not wanting to eat, maybe vomiting, sometimes even acting confused or disoriented.
Yeah, those are definitely get to the vet immediately signs.
Mm.
Let's circle back to the underlying causes. Can we break down the specific triggers for physiologic versus pathologic oliguria and then anuria?
Sure. So physiologic oliguria, the body conserving water that's usually triggered by renal hypoperfusion. Fancy term for not enough blood flow to the kidneys.
Which could be from dehydration or low blood pressure.
Precisely. Or sometimes really high concentrations of things like sodium in the blood can also make the kidneys hold on to water.
Okay. And pathologic oliguria, the kidney damage one.
That's typically caused by acute kidney injury, AKI, which can happen suddenly from toxins like antifreeze or certain drugs, infections like leptospirosis, or even severe prolonged low blood flow. Or it could be advanced chronic kidney disease, CKD, where function has been slowly declining.
Right. And anuria, the no urine situation.
As we said, most often that signals a complete urinary tract obstruction, stones, tumors, plugs, especially in cats, or a rupture somewhere in the urinary pathway. Less commonly, it can be caused by extremely severe, sudden kidney failure itself.
Quite a range of possibilities.
Yeah.
Are there things that make a pet more susceptible? The source talks about risk factors being additive. What does that mean?
Yeah, additive is a key point. It means having multiple risk factors really stacks the odds against the pet. The more factors present, the higher the chance of developing oliguria or anuria.
Okay, so what are some common risk factors? Let's start with physiologic oliguria.
For that, think things that reduce blood flow or fluid volume.
Okay.
So dehydration, definitely. Poor heart function, decreased cardiac output. Low blood pressure, hypotension. Anything causing ECF volume contraction. Basically losing overall body fluid.
Got it. And for the more serious ones, pathologic oliguria and anuria.
Oh, the list is quite a bit longer there, which shows how vulnerable the kidneys can be. It includes having pre-existing kidney disease, of course.
Yeah.
Exposure to nephrotoxins.
Kidney poisons.
Right. Things like certain antibiotics, NSAIDs, antifreeze. Then again, dehydration, low cardiac output, low blood pressure, fluid loss. Those are risks here too.
So some overlap.
Yes. Also, electrolyte imbalances like high calcium, acidosis, too much acid in the body, being older, having a fever, sepsis, which is a severe body-wide infection, liver disease, multiple organ failure, trauma, diabetes, low protein in the blood, hypoalbuminemia, and even hyperviscosity syndrome, where the blood gets too thick.
Wow, that's quite comprehensive. A lot of things can put stress on the kidneys.
It really highlights how interconnected everything is.
Are there specific risk factors more strongly linked just to anuria, particularly the blockage kind?
Yes. For anuria, think urolithiasis urinary stones, urinary tract cancers or tumors. That condition in cats, idiopathic feline lower urinary tract disease, or MLUTD, which often causes inflammation and spasms leading to blockage.
Okay.
Also problems with the nerves or muscles controlling urination, trauma to the urinary tract, and even significant blood clots in the urine, gross hematuria that can physically block things up.
All right, so a vet sees a pet, suspects oliguria or anuria based on the signs. How do they pinpoint the actual cause? What's the diagnostic approach?
The first big question is this physiologic, the body just conserving, or is it pathologic, meaning kidney damage or a blockage?
How do they tell the difference initially?
Well, with physiologic oliguria, you often see other signs of poor perfusion, like pale gums, maybe a fast heart rate, but weak pulse, cool pause. There's usually a history suggesting fluid loss, like vomiting or diarrhea.
Okay.
Crucially, the blood work, the kidney values like BUN and creatinine, are often still normal or only mildly elevated at this stage. And importantly, giving IV fluids usually resolves the low urine output fairly quickly.
That makes sense. Rehydrate, restore blood flow, and the kidneys kick back in.
Yeah.
What about when it is pathologic oliguria or actual renal anuria?
Then those risk factors we just listed become really significant clues. If it's chronic kidney disease progressing, the owner might describe that history of, drinking more, peeing more initially, weight loss, poor appetite.
The classic CKD signs.
Exactly. In these cases, the kidney values in the blood are usually already high, and just giving fluids often doesn't make a huge difference to urine output. And pets with CKD are unfortunately more vulnerable to tipping over into an acute injury.
That sounds like a dangerous combination.
It can be.
And how about diagnosing anuria caused by a blockage or a rupture? What are the clues there?
History is vital again. The owner describing that repeated, non-productive straining is a big one. Maybe a history of blood in the urine, painful urination, past stones, or recent trauma or urinary procedures.
Okay.
Then the physical exam. For a blockage, the vet might feel a very large, firm, often painful bladder. Sometimes they can even feel stones or a mass in the urethra or bladder area.
Right.
If it's a rupture, they might find fluid building up in the abdomen ascites or swelling under the skin. Again, abdominal pain is common. Sometimes the bladder feels small or can't be found if it's ruptured. Evidence of trauma might be present.
And kidney values.
They can definitely become elevated in obstructive cases too, as the backup pressure affects kidney function and wastes aren't eliminated. The key difference is, once you relieve that obstruction or fix the rupture, urine flow often comes back pretty quickly, assuming the kidneys haven't suffered too much secondary damage.
So the physical exam and history give a lot of direction. What about lab tests and imaging? How do they fit in?
They're crucial. Blood work, a CBC and biochemistry panel, and urinalysis are standard. We look for those elevated kidney values, BUN and creatinine, though they might be normal if it's very recent.
Yep.
Potassium is a big one, often high in pathologic cases and blockages, less commonly high in simple dehydration unless there's something else going on, like Addison's disease.
And the urine itself, what does that tell you?
A lot. Urine-specific gravity, or USG, measures concentration. In physiologic oliguria dehydration, the urine should be very concentrated, USG over 1.030 in dogs, over 1.035 in cats usually. If the urine isn't concentrated in a pet that's clearly dehydrated or sick, that suggests the kidneys aren't working properly, either primary kidney damage or maybe effects from a blockage. In severe renal anuria, the USG is usually low. With post-renal anuria, blockage rupture, it can be variable, but often concentrating ability is lost after an obstruction.
So the urine concentration is a really key piece of the puzzle. What about imaging? X-rays, ultrasound?
Absolutely essential, especially for ruling out those post-renal causes, blockages, and ruptures. Abdominal x-rays and ultrasound let us see the kidneys, the bladder, look for stones, masses, fluid in the abdomen.
Gives you a visual.
Exactly. Sometimes we need more advanced imaging, like contrast studies injecting dye that shows up on x-rays. That can definitively show a blockage or leakage from a rupture.
Are there any other procedures commonly used?
An ECG, the heart trace, is important, especially if potassium is high, to check for effects on the heart rhythm. Sometimes, erythrocystoscopy using a tiny camera can directly visualize the inside of the urethra and bladder to find blockages or tears.
What about putting a catheter in?
Placing a urinary catheter can sometimes tell you if the lower tract is open, but it's not usually the first go-to diagnostic. It can be misleading, maybe you can't pass it for reasons other than a blockage, and it carries risks of trauma and introducing infection, so it's used carefully.
Okay, that's a thorough diagnostic process. Now, treatment. The source really stresses this is an emergency. Why the urgency?
Because the consequences of not treating it are dire, and they happen fast. That buildup of toxins, uremia, the high potassium affecting the heart, potentially causing fatal arrhythmias, severe acidosis, sepsis from infection, these can all lead to death within hours or days.
Right.
Plus, prolonged lack of blood flow to the kidneys, even if initially physiologic, can cause permanent ischemic damage.
So time is absolutely critical. What's the immediate first step in treatment?
Stabilize and perfuse. Get intravenous fluids into them immediately, usually a balanced solution like lactated ringers or saline, to restore blood volume and improve blood flow to the kidneys. That's priority one.
Okay, fluids first. What about treating the underlying kidney issue if it's renal oliguria or anuria?
For primary kidney problems, honestly, treatment is often largely supportive. We manage the symptoms, the electrolytes, the hydration, and basically support the patient while hoping the kidneys can recover some function.
So not many magic bullets for the kidney itself.
Generally, no. It's crucial to stop any potential nephrotoxins, correct things like high calcium if present, restore that perfusion. But specific cures for most types of AKI once oliguria sets in are limited. Leptospirosis is one exception where specific antibiotics can help.
And if it's anuria from a blockage?
Then the absolute priority is relieving that obstruction ASP. That might involve non-surgical methods like trying to flush stones back into the bladder with retrograde urohydropropulsion, placing a urinary catheter to drain the bladder, or it might require surgery to remove stones or tumors or repair ruptures.
Makes sense. Get the drain unblocked. Now, the source mentions diuretics, like furosemide or mannitol. When do those come into play?
Right, diuretics are used sometimes, but only in cases of renal oliguria and only after we're certain the pet is properly hydrated and has good perfusion. Very important point.
Why only after hydration?
Because giving a diuretic to a dehydrated patient or one with poor blood flow will just worsen the dehydration and can actually cause more kidney damage. It's counterproductive and harmful.
Okay, so fluids first, then maybe diuretics if it's a kidney issue. What's the goal of using them?
If a diuretic successfully increases urine output, converts the oliguria to non-oliguria, it can make managing fluids and electrolytes easier. It might also suggest the kidney injury isn't quite as severe. Furosemide is common, given as a bolus, maybe followed by a continuous infusion or repeat doses. Mannitol is another option, given IV.
Are there times you wouldn't use mannitol?
Yes, definitely avoid mannitol in patients who might already be fluid overloaded or have significant heart failure or pulmonary edema.
Got it. What about those other drugs mentioned, dopamine and phenoldiprem?
Dopamine at very specific low doses has been tried in dogs. The theory is it might improve renal blood flow and filtration.
Does it work?
Its effectiveness is actually not well established in dogs with AKI. Higher doses are definitely harmful. They cause vasoconstriction and arrhythmias. If it's used, it's often with furosemide, and if there's no response within a couple of hours, it's stopped. And it's not used in cats.
Okay. And phenoldiprem?
Phenoldiprem is another drug affecting kidney blood flow. In healthy cats, it causes a delayed increase in urine, but we really don't know if it helps oliguric cats. So its role is uncertain.
Seems like diuretics are the main medication considered. And cautiously. Are there general precautions vets need to take when treating these cases?
Absolutely. Fluid therapy is a balancing act. We have to hydrate them, but avoid overhydration, especially if they're not producing urine. Once any deficit is corrected, fluid plans need careful calculation.
What happens if they do get fluid overloaded?
Dialysis might become necessary in severe cases to remove excess fluid and waste products.
Hmm.
Also, remember, correct dehydration before even thinking about diuretics. Use drugs cleared by the kidneys very cautiously, adjusting doses. And be mindful of potassium in fluids. Don't add it unless levels are low. And monitoring.
Yes, continuous ECG monitoring is often recommended with high potassium or if using drugs like high-dose dopamine. And be aware of drug interactions. Furosemide might increase the toxicity risk of some antibiotics like aminoglycosides.
It sounds like incredibly intensive care is needed. How is the patient monitored during treatment?
Monitoring urine output is absolutely critical, especially early on. If we can't measure it accurately otherwise, placing a urinary catheter is often necessary.
Using sterile technique, I assume.
Oh, absolutely. Strict aseptic technique is vital to prevent introducing infection. If a catheter is needed, intermittent catheterization might carry less risk than an indwelling one. But if indwelling is needed, keep it in for the shortest possible time and always use a closed, sterile drainage system.
What else is tracked closely?
We recheck blood work frequently, kidney values, BUN, creatinine, potassium usually every 12 to 24 hours, or even more often if potassium is severely high. And ECG monitoring continues intermittently to assess the heart's response to treatment and the effects of potassium levels or drugs. Makes sense. Now, looking ahead, what can owners do to try and prevent these serious conditions?
Well, prevention mainly revolves around avoiding known risks. Be extremely cautious with potential nephrotoxins, discuss all medications with your vet, Keep antifreeze and other toxins securely away from pets.
Good advice.
And prevent dehydration and significant volume loss. Ensure access to fresh water, especially in hot weather, or if they're prone to vomiting or diarrhea. Manage underlying conditions that could contribute.
What are the major complications we worry about if treatment isn't successful or timely?
We've hit on most of them, but the big, life-threatening ones are hyperkalemia leading to cardiac arrest, severe uremia poisoning the system, profound dehydration, the opposite problem of fluid overload, and serious bacterial UTIs that can potentially lead to sepsis.
And finally, the tough question.
Oh.
What's the prognosis? What's the likely outcome for pets with Oliguria or Anuria?
It really depends on the cause. Honestly, for oliguria or anuria caused by acute or advanced chronic kidney disease, the prognosis is generally poor to grave unless urine production can be successfully restored. Without that, survival is unlikely.
That's sobering.
It is. However, for anuria caused by a urinary tract obstruction, if it's diagnosed and relieved promptly before severe secondary kidney damage occurs, the prognosis can actually be quite good. Restoring urine flow often leads to recovery.
So catching those blockages early is key.
Absolutely critical.
Okay, well, this has been a really comprehensive look at Oliguria and Anuria. I think the biggest takeaway for me is just how serious any significant decrease in urine output is, and that it needs immediate veterinary assessment.
Exactly. It's a major red flag. Whether it's simple dehydration that needs correcting or something much more complex like kidney failure or complete blockage, finding out the why quickly is paramount.
It really underscores the importance of noticing those subtle changes and trusting veterinary diagnostics to uncover the cause.
Definitely. Early recognition and intervention make all the difference.
Which leads us to our final thought for you listening. Given this delicate balance of kidney function and fluid regulation we've discussed, what other, maybe seemingly small, changes in your pet's everyday behavior, eating, drinking, energy level, anything, might actually be an early whisper of an underlying health issue that warrants looking into? Something to keep in mind for proactive care. Thanks for joining us on this deep dive.